Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of Geriatrician Dr. Andy Mencia. Here we go again.
Well,
how do you feel being here for another half an hour?
I love it.
You're going to get bored?
You. I love this. I love doing this. It's so wonderful coming here.
It is. This is like our little house, isn't it?
Yeah.
On Saturday morning, our little house. Well, now we're having a discussion, of course.
About geriatricians.
Yes, about geriatrician, and that's what your article is going to be in July.
You know, it's a huge deficit in the country, so because there's such a huge deficit in the country, I have, since the beginning of time that I got my degree as a geriatrician, I spent a good amount of time educating other doctors. I spent a lot of time educating other doctors on taking care of the elderly and taking care of the baby boomers and practicing preventive medicine. So, geriatric medicine, you know, as you know, Anita, you've been a gerontologist yourself. Geriatric medicine started in England. Thank you. It really started in England.
Really?
And, yes.
Wonder why.
I don't know. I guess.
So did hospice.
Hospice started in England also. Yeah, right. So they had in the medical school, they started having extra training, just like we do for pediatric, taking care of kids. They noticed that the society was aging in England. The doctor didn't really know how to care for the elderly. And some of the elderly physicians say, you know, why don't we start training younger doctors to take care of us? Because then they notice as they age themselves that the body was not the same.
Now that's a good point, and that's what I want to. I really want to talk about that because there is a difference in a person who is older, of course, as you know, and a person who, is just like I am. I guess I'm older too, but I never think of that.
We are all older.
Yeah, I know.
That's good. That's a good thing. I tell my patient, be grateful you are aging. If you stop aging, you have a problem.
That's true. But there is a difference in a person who is growing older and, who, let's say, is in their 70s, 60s, 70s, 80s, and how to treat them. Because I think you've talked about this many times, about giving them too much medication, under-medicating them, over-medicating them, and that's really, I think, where your training came in. And I was going to ask you, what were some of the things that they taught you as a geriatric physician? Maybe that's
one of the things that I learned is that as the body ages, it's become more fragile. And every organ in your body, as we age, for example, your hearing. When you are a young kid, you can blast that music and, listen to the radio, put on the headphone. But as those organs start aging, you do the same thing to an elderly person. They'll become dead for the rest of their life because you're just going to kill their tympanic membrane. And, the whole hearing apparatus is just going to go down, and there's no hearing aid that will be able to bring that back. The kidneys. I wrote the book on the kidneys.
Yeah, we never talk about that enough, right?
And,
that's a good book.
The kidneys are the filters that take your blood. Every heartbeat, that blood is going to go through the kidney, through millions of nephrons in the kidney, which are filters, small filters inside the kidney. Well, as we age, once we go past the age of 40, those nephrons start shutting down. They start coming down and coming down. So you can have kidney working at 100%, and, those patients, regardless of their age, those patients that come to me every 3 months, I say, if your insurance allowed every 3 months, just let's do a blood test every 3 months. And what we're doing by that, some of my patients, well, my other doctor will do it once a year or every 5 years. And I say, well, it's your choice. We can do it once a year. We can, there are patients that come to me that are stubborn, that come to me when they feel bad. They don't come to me to do preventive medicine. They just, if they don't feel right, they will come in. But that's no good prevention. Because when you get that blood test every 3 months, and you look at the kidney and you look at the liver, I'm so proud. I have a young kid that came to see me from El Salvador. And he was just having body aches and pain all over. And his liver was failing on him. So we went through all the checkpoints, like a pre-flight. And I told him, what to do and what not to do. And this week he came for his follow-up. And we did the blood test. And Shirley, my lab co-director with me, she goes like, oh, Dr. Mencia, I know you're waiting for this test on this guy, but I cannot run it today. I said, oh, my God. So I have to wait for the next day to get the result. I was more anxious than him. Because I want to give him good news because he was really following my instruction. So we get the blood test the following day. And he came yesterday for his follow-up, and I was just waiting for him. And the staff knew I was waiting for him. And I said, look at your liver. It's completely normal. Look at that. We fixed your liver. And he's a young kid.
Now, but how did you do that?
He went to another doctor, gave him a very strong medication that he didn't need, treated him, and he was with the medication. He was also drinking alcohol. But he's not a heavy drinker. But he was drinking alcohol. So the combination of all of that got him to where he was. And the liver started failing on him. And he worked as a cook in a restaurant. And one of the employees said, you should go and see Dr. Mencia. Just, go and see him. He's a great internist. You're going to like it. So he came to see me, and he,
You could have saved his life.
Right. We say, and this is at a young age. So imagine as we age, you take this kid and you add 50 years to his life. He's on his late 20s. So you add 50 years to his life and give him the same antibiotic on the same condition, and he will go into cirrhosis of the liver. That will never come back. So, the kidneys and the liver and the heart and the lungs, all those organs, we need to be cautious when we take medication. And a lot of time when I'm training other doctors, they say, what is the key of taking care of the elderly? I say, one of the main things that I learned through life is that instead of adding medication, take away medication. Get rid of medication. So,
wow.
You get a lot of young patients in their 30s, and they have high blood pressure or they have diabetes. And if they are in their 30s or 40s, of course, they mean they're still in the workforce out there. So most of those people would say, okay, I have to take 3 medications for my blood pressure. So they take them all together and they go on about their business. Now you take that person at 50 years to their life. And that's the wrong thing to do. You want to spread out. If you do have to take more than one medication for one given condition, let's say hypertension or diabetes, you want to spread them out throughout the day. You don't want to take all your pills together. And I tell my patient, sometimes, no, I'm just, they are 80-something years old. No, I'm just going to take all 3 together so that way I don't forget. I say, what's your rush? Where are you going? You going to work? You're going to get into rush hour and you're going to forget? I say, you don't have to do that. That's not for you. Spread them out.
Well, spreading them out, discuss why that's spreading them out.
Because
too hard on the body to have all that at one time.
When you take 3 pills for one condition, let's say high blood pressure, you take 3 pills for high blood pressure. Well, at 7 a.m., right? You take all 3 at 7 a.m. They're going to go down your stomach. They're going to be absorbed, all 3 of them. They're going to be processed by the liver. And they're going to go and act on your body. So by 11 or 1, you got maximal effect of all 3 pills. You go to a doctor, your blood pressure is low, everything is dandy. Now by 11 p.m., the kidneys are already doing their work. So it's trying to get rid of all the, medication only has certain half-life. It doesn't last there 24 hours. So by 11 p.m. now, all of those medications are coming out of the system. So by 3 a.m., you are completely unprotected of a stroke, of a heart attack, because you took all the medication in the morning. So there are 2 downsides of doing that. Number 1, when you get the maximum effect, that's when patients say, I don't know why I feel so dizzy, I feel lightheaded. And it's because all those 3 medications are being overwhelming to the body. It's too much for your body to handle. And the body feels lightheaded. Every time you get up, you feel like your body feels lightheaded. So at one point, it's too much. And then at 3 a.m., it's too little. There's nothing there. Now, let's take that same regimen, and let's say you take 1 in the morning and 2 in the afternoon, or 2 in the morning and 1 in the afternoon. When those pills you took in the morning are coming off, the one you took in the afternoon is kicking in. It's the change of the guard. So one medication will be coming off. Now you are not taking all of them, so you won't feel dizzy anymore because you are not overcharging your body. And when they are getting out of your system, that your kidneys are clearing this medication out and the liver is getting rid of those medication, as that's taking place, the other medication is kicking in to protect you overnight. And if you read about the time that most people get a stroke and heart attack, it's usually first thing in the morning.
True.
It's usually first thing in the morning.
So if they had taken that medication late in the afternoon, it would have held over. I've never heard anyone talk about this. Now, sometimes medication, it says do it twice a day, in the morning and the afternoon or whatever, but a lot of others, it doesn't say that.
Right.
And so why don't people, so they're not geriatricians, they don't tell them, right? They don't.
Exactly.
That's really a fallacy. But what about, for instance, I take my magnesium and I take the vitamin D. I take that together. Is that okay?
That's okay, because those are supplements.
Oh, okay.
So supplements are okay.
But maybe even with supplements, I ought to.
Right. Now, if they say, well, you need to increase on your vitamin D or you need to increase on your magnesium, if you split them, you're going to absorb more. You get better absorption. Because we need to understand, let's say the intestine, if you take the intestine from mouth to anus and you take it out of a human body and you stretch it out, it is the length, and I'm serious, it's the length of a football field. The intestine that we have, the length of a football field. That's very long. Now, if you take vitamin B12, 6 inches of that football field can absorb B12. It's not the whole football field. It's only 6 inches. So if you take B12 and you decide to take more and more and more, well, it's only going to go through the 6 inches, and it's going to be a time of transit. After that, it's just going to go down to the toilet. So the more you take, it doesn't mean the more you're going to absorb. Now, if you take some now and you take some later, the one that you took now will go through the transit and go through the 6 inches, and some get absorbed. You take some later, you're going to go through that process again. You're going to absorb more. So taking all the supplements, some people say, oh, I take 22 supplements, I take them all together. Well, they have to go through these windows called receptors. And they're going to compete with each other for those receptors. The wind is going to say, sorry, Charlie's coming through right now, so Johnny, you have to keep on going. You know?
That's what he always does. I love when he does this. I love when you do this. But now it's the first time I think a lot of our listeners are really getting this. I know I am. And I have about 3 people that live in my area, and they always listen. They tell me, well, Dr. Mencia said this, so I'm thinking about this myself, too. So now there will be medication if you're on, of course, an antibiotic that has to get in right away. But I think that people ought to think about that. If they're not on anything really serious, they ought to space it. Or if they are on something serious, they ought to ask, hopefully they go to you, but if they don't, they need to ask their doctor, should I take this, more in intervals?
Absolutely. And it's sometimes the doctor will not know the answer.
That's right.
They won't know the answer.
Whatever you want to do,
you have to ask them, have you been to Dr. Mencia's lectures?
Exactly. Dr. Mencia.
That's why I love the show. I love
conversation.
coming here and doing the show because it's so educational. It's all about educating people. Because, and that's why we are so happy. I have one of my patients that listen to us in the show and call us for home visits. So we've been going to do home visits.
Oh, we haven't talked about that. But
she was so impressed. She told her daughter, I need you to get up in the morning on Saturday and listen to the doctor. I want you to listen to him. So the daughter listened, so she got hooked on the show.
She got hooked. I know the people we have them hooked.
She brought her mom to the office. And it was so difficult. I said, why you do that? I said, because she wants to meet you.
Oh.
She want to come and meet you. She's so happy with the home visit that you guys are doing. And when it comes to geriatric medicine, sometimes we get homebound and people think the answer is a nursing home. And that's the last thing your loved one wants. Some people, they love home. They love being at home in their bed with their pictures and their belongings. And, you get people that say, I want to die here. I don't want to die in a strange place. They don't even want to die in a hospital. And I do my very best with my patient to avoid them being hospitalized.
And you can have hospice at home.
And you can have hospice at home. You can have everything at home. In today's age, you can have everything done at home. And, when I meet with my staff that is doing the home visit with me, I say, make sure that the same dignity we provide in the office, we provide when we go home. We are in their castle. So we just don't go and sit and do this and move chair. It's their home. It's their place. You ask for permission. Can I move this chair? Can I clip your nail over here? Should I sit you over there?
I don't know how you got like this. I don't know where this all came. Your grandfather must be up there with wings flying over, watching over you. I just can't express how, in my heart, everything you talk about is everything that I've always believed for older people at home, but so few people appreciate what you've been saying here.
Yeah,
it's beautiful to have you.
And it had been my dream, it had been my dream to change the way medicine is being practiced, especially when it comes to the baby boomers and the geriatric patient. The baby boomers so important because that's when you really can shine and be a hero, when you take people and you prevent people from having disease. We have the ultrasound machine in my office, and that machine is paid for. So the machine, there's no overhead, it's paid for. But every time I do an ultrasound of the thyroid and I diagnose, a cancer of the thyroid, and I send the patient for surgery and save their life, I'm so happy to have that machine.
Of course.
The other day I had a guy that came in and he said, I have this little lump in my breast. So I asked him, like when you're having sex with your partner, anything, rough? No, nothing like that. I said, let's do an ultrasound. So he has cancer of the breast.
Excuse me, so when you felt it, you realized there was something there?
There was a lump. He was taking a shower and he touched his breast and he felt a little lump.
That's not
there.
unusual in a man. It is unusual, isn't it, for a man to have a lump in the breast?
Yes, it's unusual, but it does happen, and men, we should check ourselves, check our breast, because wherever you have breast tissue, you can have breast cancer. The only person that cannot get breast cancer is the person that had a mastectomy, men or women. But as long as you have breast tissue, we are all prone to breast cancer. So we did the ultrasound right away. And
excuse me, and what does an ultrasound show, Dr. Mencia?
Ultrasound is the least invasive, basically no radiation way of looking at your body, inside your body. So with the ultrasound, for example, we can look at the heart. And with the electrocardiogram, we can only look at the electrical portion of the heart. With the ultrasound, we can look at the chambers, how they're working. We look at the wall, are the wall working properly and good synchronization? Or is one part of the wall sort of not working right? That means that you probably had a silent heart attack and you are not aware of that. We can look at the pump in the heart to see how well the heart is pumping. Is it pumping properly? And are you taking medication that is slowing down the pump? There are medications that will affect the pump in the heart. So your heart is not pumping.
And you
all
can
the
see
blood.
this all from
you
an
can
ultrasound.
look at all from the ultrasound.
And so what did you see with the lump?
Yeah, with the guy with the lump, we saw that the lump was it was not that round, benign looking lump. It was a lump with little feet sticking out. So which shows sign of malignancy. And he just noticed that like within the first 2 or 3 weeks before coming to see me. So I said, it looks like an aggressive cancer, so we are not going to waste any time. And I told one of my personal checkout, Patricia, who is very diligent. And I said, Patricia, get on that phone and get me an appointment on this guy today. I want him to be seen today.
With an oncologist?
With a surgeon.
A surgeon.
With a surgeon, because we have to move. So I said, okay, let's get back in the room. And I said, I'm going to do all the pre-op. When you're going to go for surgery, they send you for your pre-op, for your medical clearance. So I said, let me do all your lab. When you go and get this chest x-ray, we did an electrocardiogram. I did all the blood tests that I know a surgeon will require. So he said, well, how you know he's going to do surgery? I said, I'm telling you, he's going to do surgery and I want to be ahead of him. When you go to the surgeon, you tell him, Dr. Mencia already did my clearance. So that means he can put you on the book tomorrow for the surgery. So he got the appointment that day. Patricia got on the phone, got him the appointment. They went to the surgeon. He told the surgeon, Dr. Mencia already did my clearance for surgery. So he got on the phone. The next day, he was on the operating table. So we were able to remove the entire cancer.
And it was?
It was absolutely, no question about it.
Good for you.
And went to the lymph node, took some lymph node out. They were benign, so we cut everything very early in the game. That is preventive medicine.
Wow, that is so wonderful. And I know the time, even though we had an hour, but this was such a great show. I mean, I learned so much from you as everyone else was. But let me give a phone number. Dr. Mencia is rushing down to his office on Commercial. If you don't have to have an appointment, but it's much better. Please go see him if you have any of the things we've been talking about. You want a geriatric physician. We're so lucky that he is here in South Florida. There are very few of them. The phone number to call is 954-489-1345, 954-489-1345, and the website is agifl.com. It's called Adult Geriatric Institute, but it's agifl.com. Homebound patients, Dr. Mencia, it's been wonderful having you here. I really like this topic.
Thank
I really
you.
appreciate you.
Happy 4th of July.
Okay, yes, and we'll see you.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.